everyone, welcome back to Daytime. Dr. Ron Nusbaum is back. He's the CEO of Back Clinics of Canada, and with him today is Andrea Bowles, who is a patient. Welcome to the show, folks.
Hey, nice to see you guys again.
I thought I was going to screw that up, but here we are with a perfect intro. I want to talk to you first, Doctor, about the fact that your chiropractic care is not the traditional crack a back, see you next week type of care. Tell me about the difference between your care.
Well, first of all, conventional chiropractic care is awesome, and I still have a very busy practice doing that. But I developed a system of care called the High Performance Healing System to address certain problems that chiropractors, physiotherapists, medical doctors, nothing seemed to help with. And these are patients that are suffering from severe back or neck pain that's due to bulging or herniated discs. People have heard these terms, but people don't really know how severe this problem can be and how it can affect the population to the degree it can.
Andrea, what was your situation with your back, and why did you go to the Back Clinics Canada?
Yes, well, I've been in and out of pain for about 10 years now. I finally got an MRI done and discovered that I had a herniated disc, and I'm very active, and it was just, it was killing me that I couldn't work out or do any of the things that I love to do. So actually my brother recommended that I go see Dr. Ron, and ever since the healing system has worked perfectly.
Yeah, it's frustrating that it took 10 years for proper diagnosis to figure out what's going on. Most people aren't as fortunate as Andrea, and after 10 years of substantial pain, they probably turn to a drug or something to sort of remedy the situation. It's an issue happening right now.
It's a big issue. What usually happens is when people suffer to the degree they do, they just will try anything and everything. And when it ultimately fails, all they can do is try and manage the pain, and then enters OxyContin. And OxyContin is a very serious drug that has high addictive characteristics to it, to such a degree that it's turned regular people into addicts just to control their pain. And not only has it turned them into addicts, there's really no way out because they haven't even corrected the problem anyhow.
Because it's still existing, so the reason you turn to the drug is still a problem.
Right.
I want to take a look at what an actual herniated disc looks like, because this is what Andrea was suffering from before.
Absolutely.
So you brought a model here just to sort of showcase, right?
Okay, so we're going to show you very quickly our spine, just so you can get a reference point.
Yeah.
So this we would collectively call the spine. Individually, these are the bones called the vertebrae, and between them are these shock-absorbing pads. We call them the discs. Inside the disc is jelly, and it's in the center normally. What happens is when there is a rupture to the lining of the disc, it can allow the gel to move offside, just like this.
Okay, so that is what a herniated disc looks like.
And what you're seeing here is the bulge pressing directly against the nerve. Now, there's no procedure that other than possibly considering surgery that actually addresses directly at the disc when it's to that degree of magnitude. And let's face it, most people don't want to have surgery, and surgeries, they're not really the best option, and they come with risks, and they're not as successful as they'd like to be. So that's what led me to the development of the High Performance Healing System, and it features an integration of a brand new laser called the Class 4K laser, and I'm happy to report that we're the first clinic in all of Canada to integrate that laser. It just got approved by Health Canada last June in 2011. We use that in conjunction with something called non-surgical spinal decompression and an amazing nutritional supplement program called Disc Renewal Plus. And this becomes the first cohesive program of its kind that deals with entirely the bulge from the outside and also on the lining of the damaged cells. It sucks the bulge backwards, and then it accelerates the healing repair of the cells of the damaged disc. So it actually not only helps reduce pain, but actually works to fix the problem.
Now, Andrea, you went in pain. How long did it take for treatment before you felt improvement?
You feel improvement after about 2 weeks, and then it progresses slowly. And I'm in week 7 now, and I feel great, and I'm ready to start running again and getting back into my regular workouts.
Well, talk to me about that day to day, because I'm sure that 7 weeks ago you were waking up and you didn't want to get out of bed.
Exactly.
What is this? It's sort of like a gift, right? What does this feel like now to be this far removed and starting to see recovery?
Yeah, I mean, it's amazing. I mean, before it was a task just to put on my socks in the morning. You know, it was painful to just do small things that a healthy back would, you take for granted. So now it's great. I, get out of bed, I bend over, can pet my dog. It's great. And then I go out for long walks now, and slowly I'm going to progress back into running again.
Brilliant.
Now, when somebody comes to you and tells you they're in pain. How do you first do a diagnostic check on them? How do you know where it's coming from? How long does that take to figure out?
Well, it takes about 20 or 30 minutes. First, we conduct a thorough health history where we discuss their problems and what they have, and if they have any x-rays, MRIs, or CT scans, I'll read them. Then we do a very thorough and comprehensive investigation that clearly identifies whether or not they have a bulging herniated disc or a degenerative disc, which is the other problem that's treated exactly the same way. And if they're a candidate, then we put together a program that's tailor-made for their needs, gives them the amount of care that they need. And the hallmark of this program is it's drug-free.
Yep.
There's no surgery. And in a couple of weeks, patients get their lives back. It's remarkable.
For people at home, such as Andrea, who have been suffering for almost a decade, it doesn't have to be a jail sentence, right? There is an opportunity to set yourself free.
Absolutely. Everyone deserves to at least find out if they're a candidate for this care, because not everybody is a candidate for the care. So we don't charge for the consultations or the examinations. And as a result, we've started to develop a bit of a reputation. People come from all over Canada and abroad because they know we're doing something different that works. So they should call us and book an appointment at 416-633-3666 or go to backclinicsofcanada.ca to learn more.
And where are you located again?
We are directly crossroad from Vaughan Mills, just down the street from the 400.
Oh,
Okay,
excellent.
brilliant,
Okay.
right in my hood.
Again, so more information, go to backclinics.ca. Thank you so much for joining us on the show. We'll be right back with more on Daytime.